Go.
Hello, Mr. Brown.
Hi.
Hi, I'm Dr. Mudlia. I'm one of the psychiatrists. I understand the team has discussed with you the next option of treatment, which is called ECT, and I've come to talk to you more about that today. Is that okay with you?
Yeah.
Mr. Brown, I understand that you've been on medication, and despite the medication, you've not improved, and the team thought that ECT will be a good option to try. Do you have an understanding of what ECT is?
I had an electric shock as a child. Is it to do with electricity?
It has to do with passing an electric current, and I can explain to you more about it. Do you know what ECT is at all?
No.
Okay. Is it alright if I can tell you a bit more about it? So I can see this is a difficult time for you. ECT is, as the name says, electroconvulsive therapy. So what happens is, like you've said, it's electricity current is passed through a person's head while they're asleep to cause a fit.
Fit?
A seizure or convulsion.
So, will that what make me an epileptic?
No, Mr. Brown. I can see why you might think that, but what happens is usually the ECT is done when someone's asleep, and when a fit occurs, what happens is it normalizes the chemicals in the brain. That's how the ECT works. So it helps for the areas in the brain to improve their mood, sleep, appetite, and improve the depressive symptoms. Are you following me?
Yeah.
It doesn't mean that if you get that you'll become epileptic. It's only a fit for that time while you're asleep. Yeah? Are you following me so far?
Yeah.
I understand that you've been diagnosed with depression.
Yeah.
Yeah. And how are you at the moment?
What's the point? What's the point of it all?
I can see you seem really down at the moment. What if I told you that the ECT is a good treatment and that at least 7 out of 10 people do recover with ECT? So the success rate is really good.
But you can get brain damage from it, can't you? I saw it on YouTube.
I think that's probably what people think. You get brain damage because they don't understand what actually happens. Like I've explained to you, it actually normalizes the chemicals in your brain and helps to improve your mood. There are side effects with this type of procedure, so it's not brain damage. What happens is it can affect your memory. Yeah, so it can affect your short-term memory, but it's usually temporary. And after a few weeks, your memory will get better. The other side effects is it can cause initially some headaches, and you might feel a bit fuzzy after the ECT, but that usually within a few hours you will recover.
Can it kill you? Because I'd say yes if it could, because that would be an easy way out.
I can see, Mr. Brown, this is really difficult for you. And obviously we want to get you better, that we don't want to kill you, we want you to improve and to get better from your depression. But yes, there is a chance that you can die, but the risk is the same as if you had a tooth extraction, 1 in 50,000, so it's a very small chance. I'd like to tell you a bit more about what happens on the day. So on the day, you'd usually go for the ECT, you'd be taken by a nurse, you wouldn't have anything to eat the night before, and then you'll go to the ECT suite, where you will see the anaesthetist, the psychiatrist, and a nurse as well. Prior to having the ECT, obviously we'll discuss, like I've come to talk to you today, we'd come and talk to you, explain everything again about the indications, the side effects, and the risks and complications, and we'd get your consent and do blood tests as well, just to check that everything's medically fit for you to have the anesthetic. Yeah?
What if I say no?
Well, if you say no, Mr. Brown, well, we have to respect what you are saying, but at the same time, we'd try to explain it to you again and find out reasons why you're saying no. In other cases, what we do is we also speak to the mental health team. We get a second opinion doctor. So, because if we feel as a team that you do need this treatment, we can't give it without your consent if a second opinion doctor agrees.
So I'll have to have it anyway?
Well, we would like you to agree, Mr. Brown, because it is a good treatment to have. But I can see you seem, a bit distressed, and obviously you're going through a very difficult time. If I can just tell you, on the day of the ECT, you'd go into a room and the anesthetist will give you a muscle relaxant. So during the whole process, you'll be asleep. And once they give you the muscle relaxant and you fall off to sleep, 2 electrodes will be placed against by your head. Yeah, and then a small electric current will pass, which will cause the fit. And that only lasts a few seconds. And usually you'll wake up after a few minutes, and you'll be taken to the post-operative ECT suite, where you will get a chance to recover, and immediately afterwards you would be able to have something to drink, and you'll be taken back to the ward. Yeah?
How many times do you do this?
Well, usually the treatment is, we do it twice a week, usually on a Tuesday and Thursday,
Right.
and up to 6 to 12 sessions. But it's not always that people have to have 12 sessions. It can be less, and we've seen people recover even after just having 1 session or 2 sessions. Mr. Brown, I've given you a lot of information. I really appreciate you talking to me. I know you're going through such a difficult time, but as I've discussed with you, and if I can summarize it, I've told you more about ECT, what it is and how it's going to help you. I would like to get some leaflets, and also if you have anyone else you want me to talk to, your family members, I'm happy to come and talk to them.
Yeah.
Thank you for talking to me.
Thank you.